The 50th anniversary is an incredibly big milestone for us. When I think about the hospital in the future, I think about a couple of things. One thing I think about is how we are operating as a hospital and serving the community, and how we continue to improve that and make that better. The other thing I think about is how we approach our facility and what improvements we can make to continue to serve the community. This is an expanding community and needs to be an expanding hospital, and we have the room and opportunity to make it better.
A separate behavioral health unit is needed that has the capacity to hold more patients. On average, we see about 11 patients in an acute mental health crisis per day, and our current BHU can only house or support 6 of those patients. The remaining 5 patients are typically within the rest of the adult emergency department, intermingled among other medical patients who are seeking medical care. Most of those patients require prolonged stays for their evaluation. In other words, the patients end up remaining in the emergency department for several hours and sometimes days, while a permanent psychiatric bed is found for them within the state of Maryland. And the medical units are just not appropriate to house a patient for hours and hours and hours on end.
So here in Howard County, we are feeling this mental health crisis that's sweeping the nation because we're the only emergency department in Howard County. We have more patients coming than ever before. Mental health care and behavioral health care has become more acceptable. I think it's what we've been striving for a long time, and I think we've finally reached a little bit of a tipping point where the stigma associated with having problems, not just a medical problem that you can see, but having problems because you're struggling in life with some kind of, behavioral or mental health problem, has become more acceptable. And as such, people are seeking out more care. Our new design for a behavioral health unit within the ER addresses several main problems. Number one, adequate numbers of places for patients to be. Right now we have 6 spaces. We're going to expand this up to a maximum of 24. Number two, it's going to be safer than being in a regular emergency department room. Sometimes our patients are very, very distraught and they need to be in a safe place. A regular ER room has lots of equipment there for saving heart attacks and pneumonias and things, but not really the right kind of a space for a person who's struggling with mental illness. Number 3 is it's going to be a bit more of a community. Right now, we can't provide any kind of treatment to those patients of a inpatient nature, like group therapies or assessments or those kinds of things. We can't do that right now because we don't have that kind of space.
One of the points of pride that I have and that many of my colleagues have is that we reside in this community. So when we impart care, regardless of the reason why someone is seeking care, we're taking care of our kids' teachers, we're taking care of our church members, our neighbors, our grocers. And so there is an additional investment that our team has. And what we want is to render that care in a more efficient way that meets the needs of our community.
I think the future looks great. The future looks very bright for us. We really want to continue to build and grow, and I'm excited to be a part of that.
As we speak to potential donors and look at their support, it's really important to understand that their support helps us build all the new things that we want in hospitals, whether it's equipment, whether it's facilities, whether it's programs. We think that there's a lot of opportunity to expand here, and we think that all of this comes back to our community. So making sure that our community supports us is a way to get the community supported. I don't think that this hospital would be the way that it is without all of that great support. 50 forward for all of us.